Viruses that infect the upper respiratory tract all cause similar signs and symptoms. They basically cause the same disease. They cause the common cold. It is the world's most common infectious disease because there are so many different viruses that spread this way and cause this. This is a clear example of our immune systems at work, where adults on average would get 2 or 3 cases of the common cold per year, but children might get 3 times as many. And some adults just don't get the common cold. And partly that is because children don't yet have adaptive immunity to the common cold. What we see is a short incubation time and then generally mild forms of inflammation and irritation of the upper respiratory tract. And so runny nose, mucus production, and then mild sore throat sometimes happens. Mild is the key word with all of these things. If any of these is severe, that can be an indicator of a lower respiratory tract virus or a more serious infection. For most people, a common cold is completely gone after about 10 days. Whereas the obvious infection part with potential strong immune response to it that we would feel, so that the malaise we might feel, that might only last a few days. Let's see. There's no real treatment for this, and there aren't that many complications. So some people can end up with croup after the common cold, but again, that's not very common. Part of the reason the common cold is such a big deal is that there are literally hundreds of viruses that can cause it. There are, hundreds of different viruses. And so if we can come up with a vaccine against 1 or 2 or 10 of them that protects us against 1 or 2 or 10 of them, but not 200 of them. So most of the cases are caused by rhinoviruses, and there are something like 100 different strains of the rhinovirus. Immunity to one does not give immunity to others, so we can be infected by a succession of these over our lives. Coronaviruses also have always caused the common cold. These are not the same virus as what causes SARS or what causes COVID, but they are from the same virus family, and we can see they replicate in the same way, but they don't affect the immune system in the same way, and they have a different tissue tropism. So coronaviruses that cause the common cold aren't going to use the ACE2 receptor to get into cells. These are going to specialize in upper airway epithelial cells. Whereas the SARS-CoV-2 can get into any cell that has that ACE2 protein on the outside of it, and that includes endothelial cells all over the body. So that's why this, if you get a coronavirus that normally causes the common cold, that's all it can cause. So the point I am belaboring is that there is not much overlap in what these do with COVID or SARS. And then adenoviruses cause some also. And if you are a researcher who studies these, you would see differences between them in the pattern of when they spread. You might see a pattern that some of them are, like we say, more contagious than others or more severe than others. But if you get the common cold, you are unlikely to have any way of knowing which of these is causing it. Because the signs and symptoms they cause are similar enough that if you have a worse cold, it's more likely the difference between a normal cold and a worse cold is the difference between your immune system being more aggressive or less aggressive. So again, we have all these different strains that can cause the common cold, but we never know which one does it unless we're doing a detailed study on it. And it's usually just not worth investigating because the common cold is self-limiting and doesn't have a lot of complications. If you're trying to remember the name of those bacteria that cause the common cold, here is a mnemonic device for you from Clinical Microbiology, made ridiculously simple. This is the famous mnemonic device they put on the cover, on the back cover of the book, which is, imagine a den of rhinoceroses drinking NyQuil and Corona beer. This rhinovirus drinking this beer, coronavirus, and if it's hanging out in a cave with others, that's a den. It's just a memorable visual. So this is a short video because it's about the common cold and there is not much more to say about it.